Nursing 345, Abdomen and Nutrition. The objectives for this week are to understand the components of a nutritional assessment, describe the role cultural heritage and values play in the individual's nutritional intake, identify pertinent topics that must be reviewed during the abdominal portion of the interview, interpret findings obtained during inspection, auscultation, percussion, and palpation of the abdomen. So for the abdomen content, this week you have an assignment in Shadow Health, the concept lab, and you also have assessment videos from your Jarvis textbook that you may find helpful. Checklists for the abdominal exam include inspection. You would inspect the contour, symmetry, umbilicus, skin, pulsation or movement, hair distribution, and demeanor. As far as auscultation, you would listen for bowel sounds, note any vascular sounds, percussion of all four quadrants and borders of the liver and spleen. Palpation, you would do light and deep palpation in all four quadrants and palpate for liver and spleen. For nutritional status refers to the degree of balance between nutrient intake and nutrient requirements. This balance is affected by many factors, including physiological, psychosocial, developmental, cultural, and economic factors. Your goal is to determine whether the patient has optimal nutrition, undernutrition, or overnutrition. By recognizing the nutritional needs of each developmental stage, you can better meet those needs. Infants, children, adolescents, pregnant and lactating women, adults, and aging adults all have special nutritional needs. Breastfeeding is recommended for full-term infants for the first year of life because it is ideally formulated to promote normal infant growth and development and natural immunity. Infants and children younger than 2 years should not be placed on low-fat diets because fat is required for proper growth and central nervous system development. Adolescent involves rapid physical growth and endocrine and hormonal changes and requires an increase in calories, protein, calcium, and iron. During pregnancy and lactation, to support the synthesis of maternal and fetal tissues, sufficient calories, protein, vitamins, and minerals must be consumed. During adulthood, growth and nutrients needs stabilize. Older adults have an increased risk for undernutrition or overnutrition because of poor physical or mental health, social isolation, alcoholism, limited functional ability, poverty, and polypharmacy. Cultural and factors and nutrient needs. Because foods and eating customs are culturally distinct, each person has a unique cultural heritage that may affect nutritional status. Occupation, class, religion, gender, and health awareness also have a great bearing on eating customs. Cultural food preferences are often interrelated with religious dietary beliefs and practices, including fasting and other religious observations. So a nutritional assessment has three purposes. First, it identifies people who are malnourished or at risk for malnutrition. Second, it provides data for designing a nutrition plan to prevent malnutrition. Third, it establishes baseline data for evaluating nutritional care. Nutrition screening is the first step in a nutritional assessment. If screening identifies nutritional risks, the patient should undergo a comprehensive nutritional assessment, which includes dietary history and clinical information, physical exam, anthropometric measures, and routine laboratory data. The easiest and most popular method for assessing dietary intake is the 24-hour diet recall. Other methods include a food frequency questionnaire, food diary, and direct observation of feeding and the eating process. Subjective data are subjective assessments of nutrition. You need to ask questions that investigate these topics: eating patterns, usual weight, changes in appetite, taste, smell, chewing or swallowing, recent surgery, trauma, burns or infection, chronic illnesses, nausea, vomiting, diarrhea or constipation, food allergies or intolerances, medications and nutritional vitamin and herbal supplements, self-care behaviors, alcohol or illegal drug use, exercise and activity patterns, and a family history of heart disease, osteoporosis, cancer, gout, gastrointestinal disorders, obesity, or diabetes. On the slide, you can see there's questions that you may be able to ask your client. Obtain additional history based on the patient's developmental stage. For an infant, for example, assess gestational nutrition, breastfeeding or bottle feeding, the willingness to eat, what is prepared, and overweight and obesity risk factors. Adolescents should be asked about present versus desired weight, the use of steroids or other agents to increase muscle size and for physical performance, and the age the individual first started menstruating. Pregnant women should be asked about the number of pregnancies and food preferences when pregnant. Aging adults should be questioned about diet differences from when they were in their 40s and 50s and review the mini nutritional assessment. As far as to obtain objective data, first you need to examine the patient for clinical signs of nutritional deficiencies. Because clinical signs are late manifestations of malnutrition, deficiencies are readily detectable only in areas of rapid turnover of epithelial tissue such as in the skin, hair, mouth, lips, and eyes. But signs may also appear in the nails and musculoskeletal and neurological system. Use measures to evaluate growth, development, and body composition. Common measurements include height, weight, tricep skin fold thickness, elbow breadth, arm span, and frame size. Perform specific assessments based on the patient's developmental stage. In pediatric patients, for example, measure height, weight, head circumference, skin fold thickness, and body mass index. Review the results of laboratory results to detect preclinical nutritional deficiencies. Common tests include glucose, hematocrit, and hemoglobin, cholesterol, and triglyceride. Use the nutritional assessment as the basis for promoting a healthy lifestyle. For example, you may teach about the keys to the healthy diet, or for an overweight person, you may teach about healthy approaches to weight loss. So laboratory studies are part of the objective assessment. Best routinely performed laboratory indicators of nutritional status, like I said, hemoglobin, hematocrit, cholesterol, triglycerides. Also, nitrogen balance is also used as an index of protein nutritional status. Nitrogen is released from catabolism of amino acids and excreted in the urine as urea. This indicates whether a person is anabolic, which is in a positive nitrogen balance, or catabolic, which is a negative nitrogen balance. There is also the creatinine height index. This is a method of estimating skeletal muscle mass. Creatinine is derived from the breakdown of creatinine, an energy-containing complex found in muscles. It's excreted unchanged in the urine at a constant rate in proportion to the amount of body muscle. Also, the total lymphocyte count and serum albumin would give you additional information. The serum albumin, glucose low and high density lipoproteins, prealbumin, transferrin, and total protein level also provide meaningful information. Your checklist for a nutritional assessment includes obtain a health history relevant to nutritional status, elicit dietary history, inspect relevant systems, your integument, musculoskeletal, and neurological systems for clinical signs and symptoms suggestive of nutritional deficiencies. Review relevant laboratory tests and offer health promotion teaching.